When the baby is born, and the placenta falls out the uterus, estrogen and progesterone levels drop and prolactin levels rise. This sudden hormonal change leads to an increase in breast milk production. When the milk-producing glands are stimulated by the hormone prolactin, they take proteins, sugars, and fats from the blood to make breast milk, and the surrounding network of cells compresses them when they contract. Smooth muscle cells called epithelial muscle cells push the milk into the ducts, from there to the milk ducts, then it is removed by the baby or the breast pump. Recent studies have shown that breast milk, especially colostrum, which is secreted in the first 3 days after birth and before mature milk is formed, provides the child with protection against environmental factors that lead to the destruction of pancreatic cells that secrete insulin and huge amounts of immune bodies 95% and resistance to viruses. Bacteria such as lactoferrin, lysozyme, interferon, and immunoglobulin, in large quantities, decrease after that when the mother forms whole milk to 25%. The resistance works to many types of bacteria and viruses, for example, cholera vibrio, salmonella, shigella, E. coli, poliovirus, herpes simplex and coxsackie viruses. Why do some women not breastfeed their babies and have a problem of milk production? Basically, the problem is due to different reasons. First, taking contraceptives that contain the synthetic form of estrogen. Taking decongestants that contain pseudoephedrine. Also fertility drugs, such as clomiphene. Antihistamines, like cetirizine and diphenhydrate. Second, the danger of food additives and industrial flavorings that hide the true taste of foods, and food colorings and industrial yeasts, at least the baking powder. Third, neglecting medicinal seeds in meals, such as fenugreek, fennel, chia, sesame flax seed, and black seed. Medicinal seeds are rich in phytoestrogens, which lactating women need to produce milk, and girls in the premenstrual period also need it for hormonal balance. Fourth, neglecting to eat the local rooster, as its meat is considered low in fat and free of cholesterol, which reduces the risk of various heart diseases. The hemoglobin level rises, which makes it a major source of iron, which is important for the health of postpartum women, after she lost a lot of blood when giving birth. It is noticeable, great customs have taken place among the Maghreb, Asian and Middle Eastern countries. They serve wild chicken immediately after giving birth. This indicates a distinct nutritional culture that the Western world lacks today. I do not know an inherited nutritious recipe that can be given to a postpartum woman on her first day with her baby in America and Europe. Rooster contains proteins that are easy to absorb. Rich in mineral salts, including calcium, phosphorus, and manganese. Rich in iron, so it is prescribed for people undergoing surgeries, in which the body loses a lot of bloods, and hemorrhage. It activates blood circulation, facilitates menstruation in women, and controls the regulation of various body hormones, including female hormones in women. Helps in the growth of children and increases height. This is due to its richness in iron. Excessive consumption of chicken fattened with antibiotics, dangerous to health, eating fast food, and industrial thickeners. Neglecting whole wheat, barley, and legumes, especially chickpeas, in the daily nutrition of women during pregnancy and lactation, can reduce milk production. Stress, sadness and psychological trauma reduce milk production until it dries up. Removing the mother from her child leads to emotional and physiological tensions in the mother, for example, when the child is admitted to the neonatal intensive care unit, as it is necessary for the mother to visit her child frequently, and touch his skin if possible. To prevent a delay in the flow of milk, or a decrease in its levels, mothers should withdraw milk from the breast as soon as possible. If not, the increased levels of stress in the mother lead to a sudden drop in milk levels. Working outside the home also increases tension and anxiety due to the large number of tasks and crowded homework, especially taking care of the infant who needs his mother to carry him most of the time and enjoy her tenderness. She needs him to continue the flow of milk, and he needs her to grow emotionally and physically. Incomplete attachment. One of the most common causes of reduced milk flow is not feeding the baby from the breast properly, as the process of withdrawing milk from the breast stimulates the body to produce more milk, and therefore the lack of attachment of the baby to the breast in the correct way doesn't allow the baby to draw milk out of the breast properly, which leads to a decrease in the level of milk in the mother. So the position of the child's attachment to the breast should be evaluated in the event that it is not sure that it adheres properly. Milk production increases when the breast is empty. In fact, most newborns need to breastfeed every 2 to 3 hours during the day and night. If a daily schedule is set for breastfeeding and the child is allowed to sleep for extended periods. Also, giving him a pacifier between feeding times. This reduces the mother's chances of breastfeeding to stimulate the breast to produce more milk, and giving it formula milk between breastfeeding periods prevents the child from getting enough milk, so it is better to practice breastfeeding when needed. Early use of formula milk. Most mothers are not aware of the importance of the colostrum produced by the breast during the first days of a child's life. Consequently, many mothers realize that they do not have enough milk for their children, and this results in resorting to formula milk, early and unnecessary. The infant spends less time with him because he is easy to pass and is not tired until full. Therefore, the baby takes less time on the breast during breastfeeding. The stimulation of milk-producing hormones decreases, and this gives a signal to the body to produce less milk, as a negative feedback, and if artificial milk insertion is necessary due to a disease, the milk should continue to be withdrawn by the pump to increase milk production more and more. Missing night feedings. The failure to empty the breasts of milk during the night leads to low levels of the hormone prolactin, which are high during the night, and this in turn leads to low levels of milk, as low levels of prolactin affect the ratio between the amount of need for milk. The amount supplied is negative. Having previous breast surgery is also implicated. There are also reasons related to the child's physical status. 1. Premature birth often leads to the birth of the fetus before the development of the processes of swallowing, sucking and breathing, and in this case, the fetus may be weak, and needs more time to grow, and rest instead of consuming energy and calories in breastfeeding, and may need to help teach him how to breastfeed. 2. Allergy. The child suffering from an allergy or sensitivity to food can lead to a disturbing behavior on the breast. 3. Oral health conditions. Some oral conditions, such as a high palate, can cause difficulty in breastfeeding. 4. Congenital defects or malformations, such as birth defects, like cleft lip or cleft palate, prevent the baby from fully attaching to the breast. 5. Gastroesophageal reflux disease GERD or acid reflux. Having gastroesophageal reflux disease or experiencing pain from stomach acid reflux may cause your baby to breastfeed poorly, not gain enough weight, and show colicky behavior. 6. Insufficient milk withdrawal. The mother may notice a decrease in the level of milk despite the fact that her milk production process is normal. And this is due to the insufficient withdrawal of milk over time, as the tongue tied or the lip tied is one of the main reasons for not withdrawing enough milk. This is a common issue in newborns, but this problem is usually easy to solve, as a pediatrician or breastfeeding consultant can help evaluate sucking conditions. Eating healthy food helps the body to produce milk in sufficient quantities, and the mother should drink at least 8 cups of 230 ml of water every day. So healthy nutrition is your only way to continue breastfeeding, to enjoy motherhood, to embrace your child, and share an affection that grows day by day. And do not forget to drink mineral water, daily and even at night.